3 weeks before Election Day, House Democrats releasing a scathing report showing how those evil health insurers denied coverage to hundreds of thousands of folks over just the last few years, and it picked up steam over the last few months, somehow forgetting to mention that their shiny new health care law has forced 840,000 Americans to already switch insurers, not stopped costs for health insurance from soaring at all, more companies nixing health insurance for their retired workers than ever before, more companies scaling back health insurance for their present workers, more conditions being challenged, more patients running out of patients. Welcome to the healthcare law rollout, and it ain't pretty or fun. And if my next guest is right, it ain't gonna get any prettier or more fun. With me now, Vital Spring Technologies CEO, Dr. Sreedhar Potarazu. Doctor, what do you make of what is fast and furious becoming just a blitzkrieg of bad news for this law?
You know, Neil, in the medical industry, there's this typical phrase that the surgery was successful, but the patient died. And this pretty much sums up how the healthcare law looks like. The execution on this is such a nightmare that, as you said, whether it's the insurance industry or the doctors or the employers, everybody is recognizing that this is going to cost far more money than anybody ever anticipated. And the lawmakers have recognized that they've probably made a terrible mistake in terms of what they've promised their constituents, and that they've in fact mortgaged everybody's futures today for the promise of a better healthcare system, which is nowhere in sight.
Now, you know, I'm not forgiving it because some of these details in this latest report provided by a Democratic House committee, I might point out, leaving that aside, are indeed accurate. Premiums have been jacked up. Coverage for pre-existing conditions have been clamped down. But why is any of that a surprise, especially when you read the law as it was being voted on, and we took the time to do that, as I'm sure you did, that
Sure.
There were guesstimates, and they were just that, guesstimates, conservative ones, as it turns out, that premiums might rise by 2 to 3% and that we would see some short-term disruptions in coverage. It turns out that they were way too mildly conservative in that regard, that the premium increases that insurance companies would be looking at to cover the millions more would have to be covered, including those orders for pre-existing conditions, would lead to this very scenario. So whose fault is that?
Well, it's an interesting question, Neil, because not to get wonky, but in this whole industry of actuarial science, when you try to figure out what insurance is going to cost, and brokers and consultants and insurance companies do this day in and day out, they try to figure out the behavioral changes. If you change a plan, what the expected behavior change is going to be, and that's a pretty sophisticated science. Nowhere did the government or the CBO take that level of sophistication in terms of the kinds of assumptions you've mentioned, and that's evident in the fact that what you're hearing now, nobody should be surprised, because from the get-go, nobody analyzed the level of detail.
But Sreedhar, do you think that some companies are, as the White House been charging, taking advantage of this sort of void here and trying to use it as an excuse to stick it to us?
No, I don't think they're using it as an excuse at all. I think they've got their backs up against the wall. And the fact of the matter is that nothing within the new law...
But these extra costs don't... Look, believe me, I'm not apologizing for insurance companies. I have been sort of, run through the mill with them on prior conditions and issues. So I have no axe to grind here. But I will say this, that some of these added costs for them don't take effect for many years. So why Zoom people now?
But that's their practice. That's what they do to employers. They've been doing that to employers for decades. When they figure out next year's premium...
In other words, they pre-Zoom you.
Absolutely. That's the business of insurance. So they guess at what the estimated consumption will be at some point in the future, then add on some premium and make hay while the sun shines.
Do you ever remember them cutting rates, though? I mean, I'm not excusing what even the administration done or what healthcare has done. I don't remember my premium ever going down.
Flat is as good as it's ever gotten. In terms of going down, it's very rare in terms of that happening. But they can't, here they've got to pay for the sick, which they're basically saying, look, we can't afford to pay for the sick people. You saw perhaps an article in the Wall Street Journal yesterday that said that insurance companies are focusing on all kinds of novel things to help sort of educate people on prevention,
Right.
of course they're going to, because they're going to get paid for that. They've got to keep their numbers above 80 to 85%.
But here's what I ask Republicans, Doc, and I'll ask it of you. With the best of intentions, let's say they want to freeze funding for this thing or suffocate it, starve it, whatever they call it, if not end up repealing it. In the interim then, these guys all are raising their rates for what could be a law whose implementation is even more years off. And in the meantime, they're collecting all that dough.
They are. They're going to be collecting all that dough. So for the next 3 years, again, they're going to run with it.
Yeah.
The current implementation is grossly underfunded. Take an example. They funded the 48 states to put up these health insurance exchanges so that if people
Right.
want to go and buy insurance, they give $1 million to every state, Neil. In the last week, $1 million is not enough for lunch money to fund the infrastructure that's required. So the states are concerned that if it's underfunded, they're going to be left holding the pot in a couple of years. They don't already have the money. They can't fund Medicaid. You're seeing the issue around pensions and underfunding there. The states are really concerned about what their risk is going to be and whether the government's going to step in.
All right. I'm sorry to step all over you on that. Doctor, thank you very much. $1 million, you're right. That isn't even a Don Imus lunch.
And don't forget the Cavuto Potarazu ticket.
There we go. You know, that's not bad. We could reach out to a very broad constituency, a confused constituency. But thank you,
That's
Doctor.
right.
Always good seeing you.